Hello, and welcome to another Health Essentials podcast. I'm John Horton, your host. Hair loss is one of the most common changes men experience as they get older. And for a lot of guys, it can start earlier than expected. But while balding is incredibly common, that doesn't make it any easier to accept if it happens on your head. So what can you do about it? We're going to talk that through today with dermatologist Chey Ranasinghe. Dr. Ranasinghe is one of the many experts at Cleveland Clinic who visit our weekly podcast to answer health questions. Now let's see what advice she has to lock down our locks and keep a hairdo from being hair done. Welcome back to the podcast, Dr. Ranasinghe. We are always glad to get some time with our dermatology team because people just have so many questions about their skin and hair.
Thank you so much for having me back. Glad to be here.
Well, you're here today to talk about a pretty big topic, and that's why men tend to lose their hair, especially as they age. I know it is a worry for a lot of fellas, and I've got to be honest. I have checked every so often to see if I'm a few follicles down. So far, so good. Everything seems to be hanging in there.
Good. Well, I truly enjoy treating hair loss because it's not dangerous. It's not life-threatening. But for many individuals, and I know we're focusing on males, so for many males, it can truly be life-changing.
It does a lot. You don't realize how much your hair means, but you think when you're going out, when you're doing anything, I mean, you fuss over it a little bit. You wanna look good. You just feel better when it's kind of there and doing what you want it to.
Exactly. Our hair, I don't think people take time to think about it, but our hair is tied to our identity, right? Our youthfulness, confidence, and that confidence can make the difference for someone to want to go for that job interview, right? And further their career or pursue a relationship and maybe meet their lifelong partner.
Well, I think my hair has gone past youthfulness now. I'm squarely in the oldness, so the color's kind of giving it away there. So
it adds to some wisdom and maturity, John.
Well, that's what I try to go with, but we're working on it. So when we're talking about hair loss, like what's causing guys to just kind of lose their hair?
So that's the first question is, Doc, I don't understand why does this happen to me. And I tell patients, male pattern hair loss is incredibly common. And most men don't know why it's happening or what they can do about it. And a lot of times there's all these myths and all these other reasons why patients think this is going on. I mean, I could list them for you. My testosterone is too high, or I'm wearing my baseball cap too much, or I'm overly stressed. But for vast majority of men, none of those are actually the primary reasons. The real culprits, too, I'll blame are our genetics and our hormones. Hormones being, the major culprit there.
Well, so what is it with the hormones? Like what's going on that just kind of causes your hair to kind of recede?
So there's one major player called DHT. It's a hormone, otherwise known as dihydrotestosterone. And I love using analogies in my clinic with patients. So I say, compare the hair follicle to a factory. And think of that hair follicle as a tiny factory that's producing a hair fiber. And in male pattern hair loss, that factory doesn't just shut down overnight. It just gets smaller and less productive. And some men inherit factories that are just extremely sensitive to that hormone we just referred to of DHT.
Okay, so does the DHT just kind of slow down? Do you not have as much of it?
So where does DHT even come from? So testosterone gets converted to DHT. And DHT is completely normal. It's not harmful. The problem isn't that you have too much of the DHT. The problem is that your hair follicles are just too sensitive to the DHT.
Oh, so it's not the DHT that's changing. It's just the hair follicles kind of they don't, is it absorb it right? They just don't respond to it as well?
Those hair follicles are genetically susceptible to the DHT. So when the hair is exposed to DHT in certain follicles in a certain pattern distribution, for example, for males that are having that receding hairline in that pattern distribution on the temples, those hair follicles are not just suddenly dying, right? The factory isn't just shutting down when DHT is exposed to it. The hair follicle is just shrinking, otherwise known as a process called miniaturization. So the thicker hairs become thinner, those longer hairs become shorter, and eventually those follicles just produce something a little bit more than peach fuzz, otherwise referred to as vellus hairs in our clinic.
So you're just kind of going backwards there, and the follicles just they kind of slow up, and they just aren't going to give you that lush hair that maybe you had when you were a teen.
Exactly. You got it right.
Wow. Okay. So that's what's going on the hormone front. You had mentioned genetics, and I had to laugh when we talked kind of ahead of this. I've always heard, I guess, the same wives' tale that everybody's heard, that it involves your mother's father, and if you look at them and they have a full head of hair, you're good. And you told me I've been sold a bill of goods. So, so what is the genetic component there?
Yes, I hear that question so often. I mean, I just heard it this morning today, when I was chatting with one of my friends. Which parent did I inherit this from? And the truth is, it's both. Hair loss is polygenetic, meaning multiple genes are contributing to that process of the miniaturization and where that pattern distribution of those genetically susceptible hair follicles are. So, bottom line is you can't blame one side, it's both.
Okay. Well, moms everywhere will be happy, or I guess moms, dads will be happy. They're off the hook.
Yes, exactly, exactly.
Now, what about just aging in general? Because obviously, it does seem to come with years that the hair will kind of go back. Is that just kind of what we were talking about with the hormones? That process just kind of we see it kind of evolve as time goes by.
For majority of the men that I see in my clinic, yes, but there's always an exception to the rule. So typically, I have, unfortunately, I can see some patients as early as their late teens, early 20s that have hair loss. That's quite noticeable. But majority of the time, it's around age 35. About two-thirds of men will notice some degree of hair loss. Honestly, the hair loss that process probably started in their mid 20s, but at around age 35, it becomes more of a notable thing that they're saying, "Yeah, when I'm walking by a mirror, I'm just starting to see my scalp more easily," or in photos, "My hairline has really receded." And about by age 50, roughly 50% of men have significant thinning. They have widening of the midline part, or they have what we call that M-line recession, as well with, the widow's peak becoming a little bit more apparent. But bottom line is, it's so common. 85% of males will experience some degree of male pattern hair loss in their lifetime.
Wow, 85%. So we're all in the same boat then, it seems like, for the most part.
Yes, yes, exactly. It's something that patients don't realize is a medical condition that is common, and it's just not talked about.
Well, we're not good at talking about things, as you know. It's not something we like to share. I think, guys, you get sensitive about it, and you don't really want to bring it up.
It is associated with a lot of, like I said, the identity, masculinity. Uh, so I understand it's a hard topic to approach, but it is something that if it's on your mind, important to seek help for it.
Now, you had mentioned that pattern, and I think we've all seen it with people close to us, where it kind of starts at the temples and it works back, and all that happens. It, I take it there's a reason why it goes in that sort of lost pattern.
So when your genetic blueprint is being made, right? When you're being formed, if you will, it is in that particular distribution. For some individuals, it's right on the temples. For some individuals, it's right on the vertex of the scalp. That those genetically susceptible hair follicles that are very sensitive to DHT are being placed.
Wow.
And that is how that pattern distribution of the male pattern hair loss presents.
So it's coded in. I mean, you're created, everything's mixed up. It comes out, it's already programmed in that this is how your hair is gonna
Mhm.
kind of gradually recede. And and it does seem like you see it's in the temples and it kind of works its way back. You get that little peninsula kind of sometimes in the front, and then that bald spot right in the back. And then it seems like they just kind of meet in the middle.
Yeah, so that's why, when there is even the earliest sign of a change that's happening, it's very important that patients come in and see, their dermatologist, because there are treatments that can slow this process down, that can maybe even stop or reverse some of it if done early.
All right. Well, we're going to get to that here in a second. And so I want to say, as far as age, you'd said most time it's around 35, you really start to notice it, but that it can start much, much earlier. And I know, I mean, you will see those like almost teenagers or, college kids. And it's like, it's already moving back. So is that something you see a lot of, or are people just kind of sensitive? They don't come in?
I think because my practice does focus on hair loss, I probably do see it more than the average dermatologist seeing those younger, I don't even pediatric patients. Probably my youngest patients that I'm working with right now are around 16, 17 years old. And a part of it could be, mom and dad are noticing these changes, and one of them have experienced some form of hair loss and just want to be proactive, or, social media, right? That is bringing awareness to treatment options, or patients are able to see, hey, this is a problem and there is something I can do about it. So I do think I am seeing more patients earlier than maybe I would have 10 years ago.
A lot of times the people come in because they think it's something else other than hair loss. They think maybe there's another medical condition. Could it be another medical condition, especially if you start seeing it very early?
So a lot of patients are worried that it has to do with something underlying, like a hormonal issue. And what I tell them is what's happening in the bloodstream and what's happening at the level of the hair follicle are often two very different things. So hair loss does not equal a high testosterone level. Rarely, hair loss can be associated with hormone abnormalities, but that's the exception, not the rule. So, in certain individuals, after we do a very thorough clinical history and clinical intake on them, and after our discussions, if I feel like there may be something more going on, such as a thyroid abnormality or an adrenal gland abnormality or a testosterone imbalance, I certainly do get the appropriate labs and rely on my endocrinology colleagues as well for assistance if needed in those rare cases.
But it sounds like for the most part, if you're losing your hair, it is just you're losing your hair. It's usually not something more sinister underneath.
Exactly, exactly. Male pattern hair loss is usually a clinical diagnosis. Labs are often normal in majority of my male patients, which is good, which is reassuring. So it's like I said, it's good to talk with your physician and make sure we're not missing anything else that may be going on.
Now, let me ask you this: why are guys the lucky ones here? Where we're the ones who experience the hair loss? I'm glad women don't have to deal with it. What I guess what's kind of causing it to happen on one side as opposed to the other?
It's the testosterone. So females do experience female pattern hair loss as well, but it's in the postmenopausal phase of life. We see it more often because in postmenopausal phase of life, the estrogen goes down and the testosterone goes up. So females just experience this pattern hair loss in a different stage of their lives, not as early as males, because we have the estrogen for protecting us, right, from that testosterone and that DHT. So that's why the timing is different, but the prevalence is actually quite similar between males and females with this form of hair loss.
Okay, all right. It just seems to happen in a different pattern, though. I mean, you just don't see it. It doesn't seem as pronounced. I know maybe a little thinning, some things like that, but not that same receding the temples and the.
Not as often will we see the receding hairline in females. It will be almost like a Christmas tree pattern is what we describe it as, just thinning along the midline frontal hairline, right here, and then it's almost like just a backwards triangle going here to our vertex where we'll see that thinning there. It's again just a part of our blueprint, our genetic makeup. with how when we were formed.
All right. Well, all right. So obviously, then we have all this going on. We have this hormonal things happening. We have genetics that we're dealing with. But as we've talked about ahead of this, there are things people can do to kind of, just to maybe stop some of that receding or at least slow it down a bit. So walk us through this. How can we stop hair loss?
So again, going back to another analogy I like to use. Right now, we're outside a lot. We're tending to our gardens and tending to our lawns. And I say it's much easier to keep grass healthy, your lawn healthy, than to have to regrow the grass after the lawn is bare, right?
Right.
They're nod their heads, okay. And so when I say in other words, hair loss treatment is about preservation first, regrowth is second, right?
Okay.
So
Keep what you
again,
got.
that you get what you yes, exactly. So it's a hard pill for patients to swallow when they hear that, "Oh, I just can't give them a pill and in 2 weeks, or 3 weeks, that quickly they can just be cured of hair loss." No, it's a chronic condition. There is no permanent cure.
We're
So
not
what
chia pets, is what you're
no,
saying.
you wish, you
That's
wish,
not going to happen.
but whatever we're starting together, if you develop hair that you like, the hair is growing because of what we started, right? So you need to be on whatever we start forever if you want to keep the hair that we've grown together.
Yeah, let's talk through those medications. 'Cause I think we've
Yes,
all we've heard about them, but kind of what's the main the go-to one?
the go-tos. Yes. So there are two FDA approved treatments. One is topical minoxidil, and interestingly enough, minoxidil was actually not developed for hair loss. It still is used as a oral blood pressure medication, and it was developed back in the 70s, where researchers saw, okay, the blood pressure's under better control, but also these patients have really good hair.
Yeah, look at their hair. Yeah, they look fabulous.
Well, that back in the 70s, that led to the topical formulation of of topical minoxidil, and that's found over the counter. So if males are noticing thinning, topical minoxidil is often the first line of treatment I recommend. It works best if used early, obviously if used consistently. So that is one option.
Okay. Now you said it's a topical. It's you can get it over the counter.
Mhm.
Is it just you a little dab? You kind of put it in, rub it around like daily or something like that?
So it depends on the distribution of the thinning and where the patient is concerned. Um, for where they want to try to grow more hair. So I the way I instruct it, it may not follow exactly what's on the box. But for example, if we're just worried about the frontal hairline and the temples, I tell them directly with it's a tube that comes with the nozzle attachment on top. Just apply that nozzle right along that frontal hairline there. And I know it may sound odd for some patients, but if they don't want to use their fingers to apply it in, believe it or not, I tell them to use either a new makeup brush that they're not going to use, if it's a female, for example, or a male, or use a new toothbrush that, again, you're not going to use in your mouth to apply the medication because that dermabrasion allows for the medication to be applied more precisely to the level of the scalp. I really don't want you to waste that medication on your actual hair because that's not where the magic happens. The magic happens right here in the scalp. Um, and it allows for more precise applications. So the cosmesis of it is not too disruptive to hairstyling methods, for example.
So using your lawn example, it sounds like then you're kind of fertilizing the lawn a little bit
I
right on that ridge line, and just
got it.
does that help then? Because you said the hair never just goes away; it's just kind of not growing as strongly as it did before. So I take it then that this minoxidil it kind of works to kind of bolster the hair that's there and kind of maybe have it grow a little thicker, a little longer.
Got it. You got it. Exactly. So minoxidil is promoting blood flow to the scalp, so that those hairs can stay thicker and fuller longer and be in the anagen or the growth phase much longer.
And you said guys can just go pick this up and kind of experiment with a little bit. Are there things they have to kind of worry about? Some side effects? Any concerns?
So, like with anything, there's always some considerations and side effects. The main one being scalp irritation. Some patients can experience. The dosing is twice daily on label. But sometimes that can be too irritating. Even once daily can be too irritating for my more sensitive skin type patients. So that's one consideration. Another is if the patient has cats or dogs, I always counsel you need to make sure that animals are not coming in direct contact with the scalp or with the product itself because it can be really harmful and dangerous to their heart. But those are the main drawbacks I would say for my male patients to consider. And also, not everyone responds.
What is the success rate? Like when you start kind of putting that in, you fertilize the field, what are we looking at?
There's so many variables. I don't think I can give you an exact number because, right, I don't know how far progressed that patient is. What are the other factors we've reviewed? And are they being consistent or not? So if you're coming in early, right, and you're just seeing a little bit of thinning, and if you are going to be putting that medication daily, twice a day religiously, I would say at least an 80 to 90% success rate that I've seen in my clinic. So it is a great first line medication for majority of my patients.
And success rate when we're talking about here, is that just then it's not you're not losing more, or do you actually see some regrowth eventually?
Both.
Both. Wow. So you do see regrowth. All right.
Mhm.
I take it you're not going to have like a giant bushy head of hair maybe again, but just you can get a little bit back.
Little bit, yeah, I would say a lot back. Again, it just depends how far progressed you are. But at the end of the day, I think the goal is just are we happy? Truly. I always say patients tell patients, I'm happy when you're happy. If we have gotten you to a point where you're not having to think about your hair daily, I would consider that a win.
Now we've been talking about the topical minoxidil. You said now it's also available in oral form.
Yes. So oral minoxidil, again, this is now we're using it off label for male pattern hair loss, and it's widely used off label by dermatologists across the world. Uh, it is great option for patients who have tried the topical minoxidil and they've either had side effects or the big factor is the cosmetic aspect of it, meaning, they don't like how their hair feels. The hair can kind of feel like a straw-like texture when used for certain individuals, or they've experienced the scalp irritation, or they just don't have the time and they're not compliant. They're like, "Doc, I can't put this on my entire scalp twice a day, every day. I got to go to XYZ meetings and I just I can't keep up with it." So they'd rather just take, a pill a day. And the results are equivalent to what we would see with topical minoxidil. It's just way easier to take.
Okay. I take it that's something too. If you have pets or things like that, it might be a better option, especially if I mean, pets are always all over the place. If they sleep with you in bed, things like that, I'd imagine that topical cream can it just gets places.
Exactly, exactly. Right. It's so much more convenient to take a pill. But then there are side effects, right, to a pill because now we are systemically absorbing that medication versus just being able to control topically where it goes on our body. So the main side effect with that is increased hair everywhere.
Okay. That's the cruel thing when you end up you're losing your hair, on your head, and yet it's going crazy everywhere else. Your eyebrows, your ears, it's not fair.
I know, right? There's no perfect medication, but I will say the body hair honestly does not affect majority of my male patients. Obviously, where is it going to be most obvious is the facial aspect of it, but males honestly don't seem to mind that as one of the side effects, which is good.
Yeah, yeah. Now the oral one, is that prescription only, or can you get that over the counter?
That is prescription only. Again, because there's more side effects that needed to be reviewed. It's also off-label use, and we have to do screening. We need to make sure patients have optimized their cardiac health, as well as there's no kidney issues, and need to make sure they aren't predisposed to swelling. So there are some things we need to discuss, in a clinical setting to make sure that this is something that's appropriate and safe for them to take.
All right. Well, that was the minoxidil side. You said that there was another FDA approved approach to kind of restarting that hair, or kind of addressing this. What would be the other one?
The other one is called finasteride. So finasteride, that is an oral medication. Again, actually, that was originated as a completely different medication. That was for, and is still being used for enlarged prostates. And when patients take that, we see you have a really great head of hair too.
It's so wild how these things just, they target one thing and it's like, wow,
Yes.
we're seeing some good stuff over here too.
Yes. Yes. And this is working a different pathway. So finasteride is reducing the amount of DHT that's being produced because it is blocking the enzyme that is converting testosterone to DHT. So remember that DHT, that's the hormone that's responsible for that miniaturization. So patients can be actually on 2 medications. Most of my patients are actually on 2 medications, meaning some form of the minoxidil, either topical or oral, and the finasteride, because the minoxidil helps the hair grow. It's the fertilizer, like you said, and the finasteride addresses why the hair is shrinking.
Okay. So you're hitting it from both angles there.
You got it. hmm and it's fairly well tolerated. But there are, now thinking about what are the side effects for the finasteride, there are some concerns for sexual side effects associated with the finasteride, and that's often our biggest barrier to treatment. But like any medication, side effects can occur, and that's just another conversation to be discussed with your physician.
All right. So we've kind of covered then the medication side. What other sort of treatments are available to maybe kind of stimulate that hair and get it growing again?
There's definitely add-ons, right? Add-ons to treatment. So one of them would be talking about red light therapy. And there are red light therapy devices that are FDA cleared for treating androgenetic alopecia, otherwise known as the male pattern hair loss. And the important thing I tell patients is you need to look at the manufacturer's description, because they need to make sure they're listing the specific wavelength. It's a sweet spot. It's 633 to 660 nanometers. That this wavelength has been shown to promote cell regeneration and boost hair regrowth. So definitely a great thing that, add on, that people can do at the comfort of their home.
Yeah. Now this, when you say like the red light therapy, is this just, I'm envisioning almost like a little cap that you wear that just has
Nope.
this red light and that just kind of stimulates the follicles and kind of helps them grow?
Yes, when you Google it, there's different forms that you could administer the red light. I personally like devices that are just easy to use. There's wands, there's headbands, there's helmets, but I am gravitating right now towards actual caps. They look like baseball caps, and within them there's the red light diodes, and you just put them on and for 6 minutes a day while you're drinking your cup of coffee or watching TV or reading a book. You put them on at the comfort of your home with minimal side effects.
Wow. I mean, it sounds like an easy way to kind of go about doing it and maybe just kind of keep things growing.
Keep things growing, and again, just add that additional coverage, right, to preserve those hair follicles. I think the biggest factor to consider, though, is they are a financial investment. But in my opinion, it's worth making if it's the right product.
How much, when you say financial investment, like, are we talking 100? Are we talking 1,000? Like in between, what are we looking at?
It ranges. I think the models that I'm gravitating towards too, because they have great clinical data, and also my patients are using them and they're coming back, and I'm seeing the clinical results are ranging between 800 to 1,000.
It is
Thousand
a big
five
investment. Yeah.
dollars. Yeah, yeah.
But if you want to keep the hair in there, I guess it's it's what you do.
Duration. Yes, yes. So not necessary, not mandatory, an add-on, an adjunctive to our therapy.
Now, what about, there was one other thing I know we want to touch on, which was platelet-rich plasma. Kind of walk us through that treatment and how you go about maybe getting that.
Yes. PRP is a wonderful in-office procedure that we provide at the clinic. I do this procedure. And what happens is you come in and see me, and you need to make sure you're very well hydrated days before our procedure, because we're going to draw a good amount of blood from you. And what happens is once we've drawn the blood, we put it in a centrifuge. We spin that blood down, and that separates our blood into different components. And what I use is that topmost component, which is liquid gold. Literally, it's our PRP, and it has growth factors. It has stem cells. It has healing proteins that your own body has created. And we remove that top layer, the supernatant, from that test tube, and we inject it right into the scalp to again boost the hair follicles, help with that cell rejuvenation, and again, it's an add-on therapy, not a necessary thing that needs to happen. An add-on therapy to those the topicals and the orals we previously discussed.
Yeah. And is that a one-time treatment thing, or do you have to keep coming back?
Yes, like with anything, maintenance is required to see results. So typically, patients come and see me monthly for the first 3 to 4 months, and then typically every 6 months to maintain the results.
So it sounds like it's one of those things. Once you start going down the path, there's a lot of different approaches you can take. You kind of see how it's going, and then it sounds like you I say experiment a little bit, but you just see what's working and what extra you might need.
You got it. It's trial and error. It's definitely a long conversation we have in these appointments, going through, what are the pros and cons of each of those treatment options? What is going to fit with your lifestyle? Um, there's so many considerations that go into deciding it. But the bottom line is determining what you're comfortable with and what you will want to continue for the rest of your life.
Yeah. And you had said that there are other treatments kind of coming down the pipeline. I guess if 85% of guys are dealing with this, you understand why they're looking to get new products out there. It looks like there's some real advances being made.
Yes. What's so exciting is for nearly 3 decades, 30 years, we've essentially had the same 2 FDA-approved treatments, right? The topical minoxidil and the oral finasteride, and that's finally going to be changing. So there are 2, new medications. One's a new topical and one's a new separate new oral medication that's coming down the pipeline. It's projected for early 2027, and if approved, they would have the potential to significantly expand our treatment options for male pattern hair loss. So I'm excited that there's something more that I can provide for patients in the near future.
Yeah, we'll have to have you back. So that's an excuse to bring you back on, which I always like.
No problem.
Now, all right, so we've touched on the medical side of it and kind of the things you can do in these treatments. Are there just basic lifestyle changes that you can make that'll make your hair happy and just kind of help it flourish?
You know, it goes back to again the basics. Hair is protein, right? It's made out of protein molecules. So we need to make sure we're nourishing our body with the right amount of protein and the right amount of protein and the micronutrients as well, meaning, zinc and iron, vitamins, in order for our body to have the building blocks and the foundational foundation to build the hair. So if we're not focusing on nutrition, which I know we spent some time talking about the last time I was on the podcast, again, the hair won't be able to grow. So that's a big portion of it is our nutrition on top of considering our hormones, if there are any hormonal imbalances. And
And that's eating just a healthy diet. I think we had mentioned before, like the Mediterranean diet, which is the answer to everything from your heart to your hair to everything. I think it's the solution for all that ails you. Getting in some protein. I know when we talked earlier, you wanted to make sure that we addressed that there are some things you should not take, and I think it was biotin.
yep. So when we're thinking, patients will come in because my patients are so knowledgeable, right, with the internet. But sometimes there can be supplements that are poorly marketed. So one of them is biotin. And biotin is a supplement that when we look at the scientific literature, patients who are taking biotin versus patients who are not, there is no statistical significant difference in terms of their hair regrowth. On top of that, it can also alter our thyroid functioning testing and it can mask enzymes that are elevated in a heart attack.
Oh,
So
well,
for
yeah.
those people, I'm like, just save your money. Honestly, spend that on a vacation rather than spending it on the supplement because that will make your hair grow more. Just relaxing a little bit on vacation more than the biotin.
Well, that's I wanna make sure we touch on it because you were like, "No, that's a definite stay away from it." It sounds like it's marketed that way because, like you said, you go online, you can find an awful lot trying to go, "Hey, take this," and, you'll be have a lush head of hair pretty soon.
Mhm, mhm. Yes, wonderful marketing, but we don't have the science to truly back up the claims.
Alright. So kind of a good multivitamin, hit you said your, vitamins A, B, C, D, E. I mean, kind of the alphabet soup there. Zinc, iron, calcium, selenium, I think we're all good for
Mhm.
hair. Okay.
Yes, yes, you got it. Well-balanced diet. I'm more about eating it rather than taking it in a supplement or a pill form.
What about stress? I know you had mentioned that earlier. I think we all kind of associate, high stress with not being good for everything with your body, but also with hair loss. Can that play a role in what's happening up there?
Definitely. I'm not gonna say it's a major reason for why males are having male pattern hair loss, but it is certainly a contributing factor because it is increasing our cortisol levels. And this hormone imbalance then disrupts the hair cycle, and that then leads to follicle dysregulation. And the hair is a very sensitive organ. Again, people don't think of it as an organ, but it is.
It is weird to think of it that way. You just think of it as hair. I mean, an organ, you think of your heart and your lungs and things like that. I don't think of my hair the same way.
Yes, it's a very sensitive organ. So, uh, another analogy. This will probably be my last analogy, but another analogy I share in clinic. It's like a rose bush. Okay, roses are so hard to grow. You have to have the right amount of sunlight and water and soil preparation and fertilizer. But if any of those factors are skewed, forget it. You're probably going to kill your rose bush. So same thing with the hair, right? If we are not having our stress under good control, if our hormones are imbalanced, if we're not using the fertilizers or we're not using the minoxidil, if we don't have the nutrients like the diet we talked about, we're not going to be able to grow and have the hair that we're striving for.
And it sounds like that's just overall just good hair care, good scalp care, is all kind of taking care of that garden, that we have
Yes,
up here.
yes, yes. Thank you for also mentioning scalp health as well. That is another big focus that we do talk about in my clinic as well is shampoo and hair care practices and how we're cleansing the scalp, how often we're cleansing the scalp, because a healthier scalp, healthier hair.
Yeah. I feel like if someone's listening to this, they're getting great hair tips and also fabulous lawn care tips. I mean, we're kind of hitting everything. So,
Two for one.
so, so with everything that we've just covered, and there was a ton and a lot that people can just do on their own, steps they can take, all of that, and be very proactive. But if someone is listening to this and wondering, what is the first step? What do I need to do? What would be your advice to them?
Yeah, if you're noticing thinning, widening part, recession at the temples, just seeing your scalp more easily, don't assume it's too early to do something about it. Seek a dermatologist, board certified dermatologist to make sure that they are doing a complete intake on all aspects of your life and getting, the lab work if found appropriate because the biggest mistake men make is waiting. And a simple step as talking with a professional and or just starting the over the counter minoxidil will help those hair follicles stay, right? It's easier to save those hair follicles, preserve the hair follicles rather than try to resurrect them.
Well, and that's the thing. It sounds like these, the things that we have to deal with it, they're not miracle workers. I mean, they're not going to take a bald head and all of a sudden, seed it and give you a whole head of hair. You've got to take care of it as it's starting to recede.
Exactly. Exactly. And remember how we talked about the statistics. Male pattern hair loss is incredibly common and it's not a reflection of your health. or masculinity or something that you've done wrong. It's biology.
Yeah.
Fortunately, it's one of the most treatable forms of hair loss that we see in clinic.
Well, I think you've given people a lot of reason for optimism. If you are a guy and you're looking in the mirror and wondering if things, aren't moving in the direction that you want with your hair, sounds like get on the phone, get an appointment, get in there and talk to somebody, and you can probably, hopefully, save what you got.
Couldn't agree more.
Well, Dr. Ranasinghe, this has been a fabulous discussion. I'm sure there's a lot of guys who will be listening to this and, hopefully maybe taking a closer look at what they've got going on and maybe take action.
Yes, I hope so too. Thank you so much for having me, John. It was always a good chat.
We love having you in here. We'll have you back soon.
Thank you.
If you're experiencing hair loss, know that there may be ways to slow your hairline's retreat, especially if you start early. So don't brush concerns off. Talk to your healthcare provider and get a treatment plan in place. If you liked what you heard today, please hit the subscribe button and leave a comment to share your thoughts. Till next time, be well.